All right, today we're going to look at erythrocyte disorders, and most erythrocyte disorders are classified as either anemia or polycythemia. Anemia is when the blood has an abnormally low oxygen carrying capacity, and it's too low to support normal metabolism. And this is usually more of a symptom or a sign rather than a disease itself. There are symptoms of anemia, however: fatigue, pallor, dyspnea, which is difficulty breathing, chills. And there's three groups based on the cause of the anemia. There's blood loss, not enough red blood cells produced, and too many red blood cells being destroyed. Those three groups are the causes of anemia, or different types. Blood loss can cause hemorrhagic anemia or chronic hemorrhagic anemia. Rapid blood loss is characteristic of hemorrhagic anemia, such as from, say, a severe wound, and would need to be treated by blood replacement, whereas chronic hemorrhagic anemia is usually caused by slight but persistent blood loss, like internal bleeding, maybe from hemorrhoids or a bleeding ulcer. And the primary problem must be treated to stop blood loss in the case of a chronic hemorrhagic anemia. If there's not enough red blood cells being produced, an individual may suffer from iron deficiency anemia, which can be caused by hemorrhagic anemia, but is usually associated with someone that has a low iron intake or impaired absorption of iron. Red blood cells need iron in order to make properly functioning hemoglobin. If they do not have iron and are not able to make hemoglobin, red blood cells that are produced may actually look more like microcytes, or really small red blood cells that are small and pale in color. They cannot synthesize hemoglobin because there's a lack of iron, and the treatment for iron deficiency anemia would be iron supplements. Pernicious anemia is an autoimmune disease, and that destroys the stomach mucosa. We need healthy stomach mucosa in order to create intrinsic factor. And intrinsic factor is needed in order for us to be able to absorb B12. B12 is important because red blood cells need it to rapidly divide. So without B12, red blood cells enlarge but cannot divide, and we get these really large kind of red blood cell-like cells called macrocytes. But the treatment is simply B12 injections or a nasal gel. We can also see that it's a problem for some vegetarians because they might have a low dietary intake of B12 because of their special diet. There's also renal anemia, which is caused by a lack of EPO. Usually this accompanies renal disease and can be treated with synthetic EPO. With renal disease, the kidneys cannot produce enough EPO, and so we must supplement. Aplastic anemia is caused by the destruction or inhibition of red bone marrow and can be caused by drugs, chemicals, radiation, or viruses. Usually the cause is unknown, however, and all formed element cell lines are generally affected. So that does set aplastic anemia apart from other anemias. We'll see problems with blood clotting, immunity defects, as well as the symptoms of anemia. And short-term treatment is blood transfusions, whereas long-term treatments is going to be with transplanted stem cells. There's also the premature lysis of red blood cells, which could be caused by hemolytic anemias, but it could also be caused by, say, incompatible blood transfusions or hemoglobin abnormalities. Usually the hemoglobin abnormalities are genetic disorders that result in an abnormal globin. There is thalassemias and sickle cell anemia as an example of hemoglobin abnormality disorders. Thalassemias is typically found in people of Mediterranean ancestry. In these individuals, one globin chain is absent or faulty, and this results in thin, delicate, and hemoglobin deficient red blood cells. There's many different subtypes of this type of anemia. There's severe forms, there's mild forms, and the very severe cases may require monthly blood transfusions. Then there is sickle cell anemia. In sickle cell anemia, there is a mutated hemoglobin called hemoglobin S. Hemoglobin S has only one amino acid wrong in a globin beta chain of 146 amino acids. This causes red blood cells to become crescent-shaped, and when they're crescent-shaped, they can't carry oxygen well, but they also become crescent-shaped when there are low oxygen levels. An example of when there would be low oxygen levels in the blood is during exercise. These misshaped red blood cells do rupture easily. They can block small blood vessels like capillaries and result in poor oxygen delivery and pain. Sickle cell anemia is prevalent in Black individuals of the African malarial belt and their descendants. There is a possible benefit, we think, to the development or having at least one gene that codes for sickle cell anemia, because individuals with only one copy have a milder disease and they have a better chance of surviving malaria. Even individuals with two copies of the hemoglobin S gene and develop sickle cell anemia, they also are going to have a better chance of surviving malaria. And malaria kills 1 million individuals each year. So there is an evolutionary advantage to having at least one gene that codes for hemoglobin S. The treatment for sickle cell anemia is acute crisis, treated with transfusions and inhaled nitric oxide. So that's kind of short term. But we ultimately want to prevent sickling by treating with hydroxyurea, which induces formation of fetal hemoglobin, and fetal hemoglobin does not sickle. We don't know why it doesn't sickle, but that's a great way to prevent the sickling effect of sickle cell anemia. There's also stem cell transplants, gene therapy, and nitric oxide for vasodilation. Here's a sickle shape of a red blood cell that contains hemoglobin S, which only has one amino acid different in a beta chain. Another erythrocyte disorder is polycythemia, where we see an increased hematocrit level as high as 80%. Polycythemia vera is a bone marrow cancer leading to excess red blood cells, and all polycythemias are abnormal excesses of red blood cells that increase blood viscosity, and that can cause sluggish blood flow. The treatment for polycythemia vera is therapeutic phlebotomy or bloodletting. And a secondary polycythemia would be caused by low oxygen levels, something like someone going to high altitude, or increased EPO production, but is usually temporary. And last but not least, for our erythrocyte disorders, we want to talk about polycythemia and blood doping. So this is when athletes remove some of their blood, store it, and at a later time reinfuse that blood back into their bloodstream. This would increase the amount of red blood cells they have before an athletic event and increase the oxygen carrying capacity of their blood and essentially produce more stamina or allow them to have more stamina during their athletic event. But this is very dangerous. It's similar to the abuse of EPO by athletes. It can cause the hematocrit levels to increase to a dangerous extent, make blood flow sluggish, and cause things like embolisms or strokes. All right, that was a short part. We just wanted to go through all the erythrocyte disorders. So next we're going to be looking at leukocytes as a formed element and kind of what they're all about, and we'll also go into platelets and hemostasis.